You're watching the station that works for you. Good Morning Maryland at 9.
Here is star of Parks and Collars, your veterinarian, Dr. John Fioramonti from the Towson Veterinary Hospital. How are you?
I'm doing fine, doing fine.
Tis the season.
Tis the season. This late summer, early fall is a peak season for fleas and ticks. So we thought we would talk to the viewers a little bit about flea and tick control to help make handling and taking care of your pets a little easier so that you don't have problems.
These are all products here, Frontline, that we've heard about.
These are some of the different products that are available on the market. The products that we normally use the most are the Protocol and the Frontline. They're topical products. If you put these products on your dogs or cats once a month, they will continue to kill fleas and ticks on a regular basis and keep you from having a serious or very large flea and tick problem. They're very easy to use. They're topical. It's just a matter of taking one of the little tubes, breaking the tube, and just squeezing it on the back of the dog's, on the back, right on the skin behind the shoulder blades. And they kill fleas and they kill ticks for up to a month. They work very well. We have some other products. If you have a really bad flea infestation, there are some pills that you can use. The Capstar kills fleas immediately within about 15 minutes. You can use it to go ahead and kill any fleas that are on your dog or cat. The problem is it only lasts for about 2 days. So if I've got a pet that comes in and has a lot of flea problems, I'll go ahead and give them a Capstar, kill all the fleas on them, and then I'll put them on the Frontline as a treatment for that.
All right.
In addition, we've got some injectable medicines that can be used too to help sterilize the fleas so that they can't lay eggs. So there's a lot of products available. If you're starting to see a lot of flea and tick problems, check with your veterinarian. Use the approved products. A lot of the store-bought brands, they've been having a lot of problems with a lot of side effects. They're a little more dangerous. They're a little more risky. So make sure you're using some of the brand name products that are available at your veterinary hospital.
All right, let's take some calls. Beth is calling in from Bowley's Quarters. Beth, you have a pit bull and on medicine, right?
No.
It's on Beneful food.
Yeah, just was wondering what's the best food to feed it.
Beneful is a high-quality food. It's a good food. It's not one of the brand names that I normally recommend, but it's a good quality food, and if you want to continue on it, you can. I tend to like the Hills products, Hills Science Diet, Eukanuba, Iams Eukanuba foods, but the Benefil will work very well for you.
All right, way to go, Beth. Bill in from Cockeysville. Bill's got a puppy, and your puppy's on a medicine, right?
Yes, my puppy is a 16-week-old Newfoundland, and she was having some problems with like a soft stool at night, so that my vet put her on Flagyl.
Okay.
And then when that ran out, it was like a day later, she went right back to the same. She was pooping in her crate, and then we put her back on the Flagyl, and as soon as she goes back on it, she stops having that problem at night. And I guess we've eliminated. She was eating some canned food, just a little bit in with mixed in with her kibble. So we've eliminated all that, and her stool seems to be normal now. But my question is, how long, can I wean her off of the Flagyl?
You probably want to wean her off when the time comes. I don't think I would try and take her off of it too soon. In the Baltimore area, we've been seeing a lot of vomiting and diarrhea, so this dog could have a little bit of the intestinal virus that's going around, or it could just be a puppy having problems. So I would use that Flagyl. I'd use it fairly consistently. When the time comes, slowly wean off of it again, and if you get a flare-up, go back on it again for another 10 days to 2 weeks. The Flagyl is fairly safe in this case and may need to be used for an extended period of time until we get that intestinal flora back to normal. You may also want to try and use some yogurt or some other bacterial additives to help get a normal bacteria in the intestinal tract, and that'll help.
Probiotic?
The probiotics, yes.
That's okay to do as well?
I would highly encourage it. In addition, you've got a little puppy. Let's make sure we get her wormed a couple of times, because sometimes worms, a low-grade worm infection will cause the same problem.
Yeah, she's been wormed, I think, 3 times now and had stool samples that came up negative, so I don't think it's the worm.
Okay.
But,
then let's
hey, can I say hi to my daughter Haley, who's home watching?
Yeah, go ahead.
I think we should.
Hi, how you doing?
Okay, thanks a lot.
All right, Bill, we'll see you. All right, thank you very much.
No problem.
You're a folk hero now. That's the first time somebody had 4 follow-ups.
What can I say?
Dr. John Fioramonti, Towson Veterinary Hospital, here with us every Thursday at this time. Linda.